All right, first we're going to be doing the internal rotators. We have the piriformis, which is innervated by the nerve to the piriformis at S1, S2. It originates from the anterior surface of the sacrum and inserts into the greater trochanter. Then we have the gemellus superior, which is innervated by the nerve to the obturator internus, which originates from the ischial spine and it inserts into the greater trochanter. The obturator internus is innervated by the obturator internus nerve at L5 to S2. It originates from the ischiopubic ramus, the posterior surface of the obturator membrane, and it inserts into the greater trochanter. The gemellus inferior is innervated by the nerve of the quadratus femoris at L4S1. It originates from the ischial tuberosity and inserts into the greater trochanter. The quadratus femoris is innervated by the nerve of the quadratus femoris, and it's L5S1. It originates from the ischial tuberosity and inserts into the intertrochanteric crest of the femur. The obturator externus is innervated by the obturator nerve at L3-L4, originates from the anterior obturator membrane, the bony boundaries of the obturator foramen, and it inserts into the trochanteric fossa of the femur. The position for this test is going to be sitting off the edge. We're going to stabilize the distal medial thigh, resist against the distal lateral ankle, and we're going to have the patient internally rotate, and compensations for this test are going to be lifting the leg off the table. So we're going to do the internal rotation. What we're going to have the patient do is have her seated. We're going to have her knee off the table, and we're going to tell her to internally rotate her hip. So you want to kind of do just like that. Okay, and then I'm going to resist the medial distal thigh and lateral distal ankle. Go ahead, do it again. Push, 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 push. Good. And then we're going to have her do the other side. Good, and resist. Go ahead. And that's going to be 5 out of 5 bilaterally. The next muscle we're going to be testing is the iliopsoas. It's comprised of two muscles, the psoas major and the iliacus. The psoas major is innervated by the anterior rami of the spinal nerves of the lumbar spine. It originates from the vertebral bodies and discs of T12 through L4 and the transverse processes of L1 through L5. It inserts into the lesser trochanter of the femur. The iliacus is innervated by the femoral nerve at L1, L3. It originates from the iliac fossa and inserts into the lesser trochanter of the femur. Both these are through the iliopsoas common tendon. Its actions are thigh and trunk flexion, external rotation of the thigh, and lateral flexion of the trunk through the psoas major. The position of the patient is going to be supine with the hip externally rotated. We're going to stabilize the opposite hip, resist the distal femur, move. We're going to do hip flexion for the movement, and we're going to be compensating or watching for compensations of hiking of the opposite hip or arching the back. So we're going to do iliopsoas manual muscle testing. I'm going to have the patient externally rotate the hip, keep the leg straight, and I want you to lift your leg straight up off the table. Good. Again, keep your leg straight. Go again. Then I'm going to stabilize the opposite hip. Have her do it again by resisting the distal femur. Go ahead, push, 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 push. Good. Switch sides. Again, externally rotate, lift up. Good. Stabilize the hip and lift up. Push, 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 push. Good. That's going to be a 5 out of 5 bilaterally, and we're looking for compensations of hiking of the opposite hip. Bending the knee could also be to shorten the resistance arm, and arching of the back. Next, we're going to be doing glute max. The action is extension of the hip. It also does some internal and external rotation, but mostly extends the hip. We're going to, or it's innervated by the inferior gluteal nerve at S5 or L5 to S1. It originates at the posterior surface of the sacrum and coccyx, gluteal surface of ilium, and the thoracolumbar fascia, as well as the sacrotuberous ligament. It inserts into the IT band and the gluteal tuberosity of the femur. The patient position is going to be prone with knee to 90 degrees. We're going to stabilize the lumbar spine / pelvis. We're going to resist the distal thigh or bottom of the foot, and we're going to have the patient extend the hip with the knee bent off the hip with the knee slightly bent off the table, and then we're going to have compensations of extending the knee or raising the hip off the table. So for the glute max, we're going to have our patient bend their knee to 90 degrees, and then I'm going to have her extend her hip off the table. Good. Make sure you keep it at 90 degrees. Do it again. Perfect. I'm going to stabilize the leg with my body so she can't extend it. And then I'm going to add resistance to the posterior distal thigh. Go ahead. Push, 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 push. Good. Other side. Go ahead and lift your leg up. Good. I'm going to resist. Push, 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 push. Good. That's a 5 out of 5 bilaterally. We're again looking for extension of the knee as a compensation, as well as hiking of the hip off the table.